My name is GIora Sharf, and I'm a CML patient for 24 years. I'm from Israel. I was diagnosed at the beginning of 2000 with CML. I was lucky enough to join the clinical trial, the IRIS trial of imatinib, the first available TKI. And thanks to that drug, I live today after 24 years. I'm here, and I'm already 8 years, what we call TFR of treatment and just being monitored. I am a very active patient advocate for CML. I started the Israeli CML patient organization in 2001, and later I was a co-founder of the Global CML Advocate Network, which today is a network connecting 130 CML patient organizations from almost 100 countries all over the globe. Very active network doing a lot of activities to help and empower CML patients all around. The results did not surprise me. Since we have very active CML patient groups in my country with almost 600 patients on Facebook groups and also a lot on WhatsApp group. I'm actually the main target of patients when they have complaints, when they have open questions, when they need advice what to do. So I've been getting questions for more than 20 years now, and some of the results of the SUN study actually reflect the situation which I know exists for patients in my country, and I assume for many other countries as well. So when I get questions, for example, of a CML patient who is on a TKI, and let's say the recommended dose is 100 milligram, and he goes to his doctor and he complains that he has side effect which makes it very difficult for him to live with on a daily basis, and he's begging the doctor to reduce the dosage of the drug because he knows that there are many other patients on the same drug that are taking lower dosage, like 70 milligrams and 50 milligrams, and the drug is still working for them. And he asks the doctor to lower the dose. And the answer he gets from the doctor, which is a very high level doctor, head of a department of hematology in one of the hospitals in my country. And he gets an answer saying that the 100 milligram is the recommended dose. I would not give and I would not sign a prescription with a lower dose. I'm sorry, I will not do it. If you want lower dose, go and find yourself another doctor. And when a patient hears this answer from the doctor, and of course, I'm not saying it's all the doctors, it's only an example of one, which is one of the leading doctor, and he doesn't know the fact that CML can be treated with this drug with lower dosage, with less side effect. It's not surprising. Another example, short one from last week, a patient which came to her doctor and asked her to switch her for another TKI treatment because the side effects are intolerable. She cannot live with it. And the doctor just refused to switch her and said, you have to learn to live with the side effect. And those are the examples of the way that patients need to deal with doctors who I say don't have enough experience with CML, and they don't have all the data, and they don't really know how to handle patient side effect, and they do not accept, like the SUN study has shown, that there is a big gap. You know that we did a lot of studies about the different perspective of patients and doctors in evaluating the severity of side effect of CML. And we saw very clearly there is a huge gap. Side effects like fatigue or diarrhea. For doctors, it's something patient can learn to live with. But for the patient, that can be intolerable and influence the quality of life, and it will not be accepted by them. So we have to learn how to overcome this gap between the patients and the doctors. I think we have to distinguish between most urgent and most important. I think the most important challenge that CML patients have today is still resistance and disease progression. But luckily, this happens in a very small percentage of the patient. So it's important, but I think still the most urgent is the fact that you have to live with the disease for the rest of the life. It's still not curable. Even patients who go on TFR, that doesn't mean that they have been cured. They still need to go and do tests and checkups every few months. So living with the disease that is not curable and taking a TKI, a drug, and every drug has its own side effect and different ones, this probably is the most urgent fact that challenge that patients are facing, and how to live with the side effect and how to improve them, how to find a treatment which has less side effects for them. And luckily, we have today in many, at least in the most developed Western country, we have 6 available TKI. And that's why it's important to have a very knowledgeable doctor, hematologist who is treating CML, because we are moving to the level of targeted therapy, that's where we can match the drug which suits the patients according to the side effect profile and the efficacy one, and how to balance between the wish of the doctor to get efficacy and outcome and the wish of the patient to live a normal quality of life. That's probably is the most urgent task we have. Well, if you ask me what's my wish, I think for me and every CML patient, the most task that we would like to have change is, of course, to find a cure for the disease, in the fact that we can take a drug which will cure the disease and then we go back to our normal life and enjoy it. So that's, of course, the most important thing that we like to have. But we have to be realistic, and we know how difficult that task is. So I think if we can settle for a second wish, if we can find a treatment which can improve the quality of the life of the patient and also have efficacy and do the work, and the patient can live with the CML and a normal quality of life, that will be second wish. And I think the most important thing that will come out of this survey is that we need to improve the communication between the patient and the doctor. I think improving the communication will help the patient to be more adherent when he needs to take a drug for the rest of his life, and he will be able to become a partner in the management of his own disease. So that's extremely important task. And like I always tell doctors when I go and speak in a hematologist meeting, I always tell them a joke, and maybe I'll tell you also the patients, and there is a learning for you also in this job. So I ask the doctors, what is the difference between God and a doctor? And the answer is that God doesn't think he is a doctor. So I think now for you patients, you have to understand that doctors are not God. They are human beings, and human beings can make mistakes, and they make mistakes. So I think it's our responsibility, the patients, to learn about our disease, about the side effect, about the treatment, and to become active partners together with the doctor in managing our disease. This way, it will improve our life, it improves the quality of the life, and we will live better for the rest of our life. Thank you.